Hi everybody, Dr. Daniel, and today I'm talking about a kind of weird situation, which is treatment of the aura part of migraine with aura. Now, all the literature and advice mostly given about migraine treatment is on acute therapy of the headache part and prevention of the migraine. And there's not much literature and people don't really talk much or write about treating the aura part, but there are some ways to do that. Now, the aura part of migraine is present in 25 to 30% of persons with migraine. And the aura usually is a visual aura, excuse me, which is flashing lights, zigzag lines, seeing half of things, objects that really move across the visual spheres. But some people may also have numbness or tingling, like in the fingers. It goes to the hand, arm, goes to the face and the tongue on one side of the body. And some of those folks also will have trouble talking, which is called aphasia, where they can think of the right word, but they can't say it. So those are the aura type symptoms. Now, the aura symptoms are thought to relate to what's called spreading depression across the brain, which is an electrical discharge that travels over the brain in the occipital part of the brain, in the very tip of the back of the head forward. There's electrical discharge that causes firing off of that part of the brain, then afterwards there's slowing of the brain activity. And that's research ideas that have been known about for about 80 years or so. So the current thinking of the causation of the aura part of migraine is related to spreading depression. The other thing is that some persons will have the visual auras or the symptoms of the aura without having any headache with it, and that's called migraine without aura symptoms, or it's called also migraine sine, S-I-N-E, migraine. And a few patients have that. I've had patients ask me about that for treatment advice. They'll come in and talk about it. If you talk to them many times, you'll be able to find a history of something like migraine without aura in their background. They may have had migraine, things that are like migraine, like sinus headache, sick headache, menstrual headache, motion sickness, and links like that to the migraine story, but they've never really thought they had migraine headaches. So what is the treatment for the aura part of migraine with aura? Well, the first thing you can do is take inhaler of isoproterenol, which is a drug used for asthma, and that'll work quickly and acutely for it without a lot of bad side effects. They've tried NSAIDs and just over-the-counter drugs, which they really don't have much data or efficacy published on that. They've also used triptans, and there have been reports on that to show that triptans really don't work. They work for the headache and the triptans, and there's 7 triptans that are drugs used for treating the migraine headache time when it comes on. 80% of persons who have migraine will respond to that for headache relief, but triptans don't work for the aura part. And then also one can be put on preventive drugs, the typical preventive drugs that doctors use in medicine. And those are antidepressants like amitriptyline and nortriptyline, beta blockers like Inderal, and also divalproax, which is Depakote. That shouldn't be used in fertile women because of problems with a baby. And also topiramate or Topamax, which is kind of short-acting, and also long-acting once-a-day treatment as Trokendi XR or Qdexa XR. So any of those drugs can be used. Probably in today's world, the CGRP drugs are really the best drugs to use, and those are Vyepti, Aimovig, Ajovy, and Emgality. And those drugs are really replacing the older drugs I mentioned earlier as go-to drugs for prevention of migraine. They're all given by injection, 3 of them by subcutaneous injection once a month, and the other one as IV infusion. Botox has also been indicated for chronic migraine by the Federal Drug Administration. It requires injections in the muscles of the forehead and the back of the neck every 3 months if it's effective. By using Botox, you can prevent 1.8 migraines per month by getting all these shots. Now I'm going to report and look at my cell phone about one of the drugs that's been used. Report has been done on the literature supporting the use of isoproterenol for treatment of migraine aura. That was published by Kupper-Smith et al. In the Journal of Stroke in 1979, so it's a long time ago. They had 6 patients with transient or permanent visual loss with migraine, and they had 3 of them who really completely got rid of the visual episodes by using that drug. One report that was done on triptans dating, when was that, 1994 in the Journal of Neurology by Bates et al., called subcutaneous Sumatriptan used during migraine aura group. And they found that triptans work great for the headache part, but it didn't work at all for aura prevention. Now there's also an article regarding Lamotrigine, which is helpful for treating the migraine. So it really hasn't been recommended much in the past for migraine in general, but some reports suggest it may be effective individually used for treating the migraine with aura. And so they found that that was helpful. So the bottom line here is use oxypropanol acutely as an inhaler, like for asthma. You can breathe it in for acute therapy for the treatment of the migraine aura. Triptans don't work. Vasodilators and other drugs, NSAIDs, don't work. And probably Lamotrigine is one of the best drugs that's recommended. You could also use any of the other CGRP drugs that I went over. So that's the end of my talk here on what can you use as treatment for the aura part of migraine with aura. Kind of an unusual subject. Good luck with you. Thanks for listening to this, and please click like down there and subscribe, and follow me on YouTube for other articles I have on migraine. I'll see you again. Good luck, and God bless all you persons with migraine.